Good afternoon, Dr. Hip. So, I chose to go over puncture wounds for my practical. Um, so, we'll go ahead and jump into it. The first big things to know about puncture wounds is that depending on the area, it's going to be best to make sure you do not remove the item from the puncture, especially in places like the thoracic cavity or the abdomen. You want to leave those things in place because you never know what they might be holding together, and you want to make sure they're in a hospital before you try to remove any of that. Now, if you have a puncture wound somewhere else, say athlete steps on a nail that's still attached to a wood board and they pick their foot up and yank it out of, may or may not be a personal experience on that one, but you want to make sure that if you can, clean away anything that's around the area or that might be in the puncture if possible. Want to rinse it out with something like normal saline. Sometimes you can find it in a bottle, something like that. And then after that, you're going to bandage it and move them to the emergency room if necessary, depending on whether or not they're up to date on their tetanus shot. So, with a puncture wound where you still have the item in place, what you want to do, you'll take your normal gauze pad here. Once you've cleaned the area, you want to try and get your antiseptic or whatever onto the pad. You want to wipe away from the wound so that you can get everything in the area around the puncture sterilized before you wrap up and move them to the emergency room. Some things that help, of course, having some scissors in your bag, tweezers, things like that, as well as tape, steri strips, things of that nature. But once you have got the area cleaned up, you want to try and stabilize the item. So you're going to take your two gauze pads or whatever you have to set on the sides of that, and you want to set it to the side of it to try and stabilize. You can use some medical tape to hold those in place before you wrap up the rest of that bandage to keep it clean. Alright, once you've got that in place, you can go and take a normal roll of ace bandage, or if you don't have ace bandage, you could use just normal medical tape for that purpose. But what you'll do, you're going to take and make sure to not wrap over the top, but you're going to go around the sides of the wound. You'll have to forgive me, this is a very large piece of ace bandage. Normally would use for a leg, so we're just going to make this work as best as possible because I am not yet an actual athletic trainer and do not have a bag full of goodies to help me with this process. But going around the object, making sure to leave it open so that it does not fall over, you want to try and go around that very roughly here, as you can tell, and then again to make sure it stays secure, as opposed to using the little clips that come with it, you could take and use medical tape to hold it in place and make sure it's not going anywhere. Okay. So, of course, very rough first attempt at a clinical skill. Looking forward to getting back to the classroom. But that's basically the gist of what you have going on with the bandaging portion. So the things you want to make sure your athlete knows when they are taking care of their wound after going to the emergency room, if they have to do that for the removal of the item, or if it's just what they need to do after they get home and have that bandage. Wound care is going to be that they need to change the bandage once a day. Make sure to reapply any antiseptic. This could be a Neosporin. It could be something that is given to them by the doctors. And then you want to make sure they know what to look for when it comes to infection. So anytime they are redoing the bandage, they want to check around the wound, the edges, Should stay probably a little red, but they want to look for any excessive redness, any heat and swelling in that area. A lot of times you'll also see like red streaks going away from the injury site if there's infection present, and they also want to make sure they're checking to make sure their temperature is not above average, because low-grade fevers can be a sign of infection, as well as swollen lymph nodes under the armpits, in the groin, or along the neck, depending on where that injury is. So, for example, if the injury was to the leg, you would want to feel for swollen lymph nodes around the groin area, because that would be the most local lymph nodes to the injury itself. So, should be about everything. Look forward to hearing your feedback on what I missed, and appreciate your time. Thanks.